Welcome back to Sleep Better TV. I'm Scott Drake. Today we continue our discussion with some dental clinicians from WIlshire Dental Care in Los Angeles, California. My guest today is Dr. Daniel Teboul. Dr. Teboul, it's a great pleasure. Thanks for joining us.
Hi, Scott. Nice talking to you.
We're going to concentrate right now on dental implants because the technology and the process has changed, in the past few years. Let's begin with what exactly a dental implant is, Dr. Teboul.
So a dental implant is actually a screw. It's a screw that has threads on the outside and on the inside. So what it does is a screw that will place into the jawbone, and it connects to the bone, and we create like the missing root. Mm-hmm. Over that, we attach like a crown portion that gets put inside the inner thread of those of that screw. So the screw is actually made out of titanium, which is biocompatible, and that integrates with the bone, and the bone doesn't recognize it as a foreign body. Okay. And that's the property that we use in the dental implant.
And what are the indications for a dental implant? When is this kind of procedure called for?
Well, there's three major indications of dental implants. One is made for single tooth replacement. So when you're missing one tooth in between two healthy teeth, we like to use an implant so we don't involve the adjacent one. We could also use dental implants with multiple teeth replacement or even full mouth reconstruction. So we place a few implants spread out throughout the mouth and we connect them together. And in some cases, we use implants to secure denture. So we place an insert into the denture, and the implant is placed into the jawbone, and they click one another like a male-female type of attachment to secure the denture in place.
It sounds logical. I'm sure someone listening here, though, who isn't familiar with this procedure will hear screws and fastening it to the jawbone, and that sounds fairly invasive. How long and how invasive is this process?
The actual placement of the implants is not invasive at all. It becomes so routine we can do an implant placement in anywhere between 15 to 30 minutes. When the case is pretty simple, it just takes a small injection, and the placement of the implant is less than taking the root out. So it usually takes half an hour at most. It's a painless process. The injection with like the product that we have these days, you barely feel it, and the recovery takes within a few days. You're back on your feet like nothing has happened. Now the whole process of having the implant with the prosthesis on it will run anywhere between 4 to 6 months. The lower jaw usually heals a lot faster. It's denser bone. The upper jaw takes a little longer, about 6 months. So start to finish, if you're missing a tooth, it's done in 4 to 6 months. Some companies are pushing to get it reduced, but when you reduce the healing time, you kind of reduce the success rate also. So we like to stick to the actual guideline. It's worth not mentioning also that if a tooth needs to be extracted, then we'll have to wait like a couple of months for that socket to fill in before we can go back in there and secure the implants. So it could extend, like if you have the tooth in there, it could take a little longer than 4 to 6 months.
And would it be safe to say, too, with the new imaging technology that's at your disposal these days, the ability to get an exact fit has gotten much easier?
Yes, we do use dental CAT scan pretty routinely. We don't take any risk with the patient. We want to know where the vital structures are, where the nerves travel, try to stay away from them, and we try to place the implant in the angulation that's ideal, so we have as much bone surrounding the implant. So we do use routinely whatever X-ray is available to make sure that this is done right.
Final question here. Talk about the benefits of using an implant over a bridge.
Well, these days the standard of care is an implant. Like if you have two virgin teeth, you very rarely consider bridge. Maybe the only reason will be for the initial cost. Because once you place a bridge, basically you have to cut down the adjacent teeth and destroying tooth structure on the adjacent teeth. And anytime you place any type of restoration on virgin teeth down the line, you'll need replacement of the crown, possibly root canal, and you can end up losing those abutments. So whenever you have healthy teeth, the standard of care is to place an implant. It's freestanding, doesn't involve the adjacent one, and teeth don't like to be connected. I mean, teeth are supposed to depress within the socket. So implants versus bridge, there's no discussion. Implant is the way to go.
Mm-hmm. My guest is Dr. Daniel Teboul. He is a periodontist with WIlshire Dental Care in Los Angeles, California. Dr. Teboul, thank you so much for joining us today.
Thank you very much. Anytime.
And I'm Scott Drake. You're watching Sleep Better TV.